In India, more than 67 million children lack access to basic medical health care. According to Times of India, over 50% of this statistic originates from low-income families, especially in government hospitals. Because of low funds, the medical care doesn't fit the patient's needs, and many doctors aren't properly qualified. According to Times of India, there is one doctor per 1,445 people in the country. Our project's aim is to start a campaign to provide necessary equipment to underfunded hospitals in their pediatric ward by raising funds.
Rajawadi Hospital in Ghatkopar is a government hospital where hundreds, if not thousands, are admitted daily to be treated. This hospital is severely underfunded and lacks a lot of important equipment. In the pediatric ward, infant radiators and protein powder for children are severely lacking. On average, 100 babies use a baby warmer per year. Ordinarily, these babies utilize it for 5 to 6 days, and because of its grueling use, the warmer gets worn down and needs to be maintained very frequently. It also needs to be replaced every 7 to 8 years. Combined with the high costs of the warmers and the inadequate funds at the hospitals, these infant radiators are denied maintenance and are broken beyond repair.
Over 900,000 children are severely malnourished in India every year, and most of their families do not have the funds to ensure their children are in a healthy weight and nutrition level. Many hospitals strive to keep protein powder for the children always in stock, as it is a practical and easy way to build the children's weight.
Rajawadi Municipal Hospital is always in dire needs of these products, as it is used by hundreds of kids per month and gets over quickly. Due to all these reasons, we, the students of Garuda International Center for Learning, Mumbai, group number 1, called charitABLE, decided to donate 2 infant radiant heaters and 14 kgs of protein powder to a government hospital in our locality. To begin this campaign, Rajawadi Hospital urgently needed these products.
To raise money to donate these machines and products, we started a fundraiser to do so. In the span of around 5 weeks, we raised 84,500 Indian rupees, which is 1,032.5 USD, exchange rate as of 9th April 2023, with help from our families, friends, and online support from the platform of Instagram.
What are infant warmers? Infant warmers are used when there are complications with birth, such as when the baby was premature, born later than its due date, or didn't cry at birth. It is used to provide for and imitate the conditions of a mother's womb and keep the baby warm until it can keep itself warm.
Usually a baby after delivery, a baby has to cry. If the baby doesn't cry, we have to intervene. That is where our role comes. That intervention is known as neonatal resuscitation.
A study conducted by the World Health Organization in 2019 states that 10% of all infants born globally need some kind of neonatal care, including thermal care, which may entail to the usage of baby radiators.
What are protein powders? A vegetarian nutritious beverage mix called ProteinX, a brand of protein powder, should be eaten as a part of a healthy lifestyle for sickness recovery. It has a special hydrolyzed protein mix that is simple to digest and promotes a quicker healing process after illnesses and accidents. It contains hydrolyzed protein, which helps your body absorb protein 50% quicker. With a high protein content, it supports muscle building while supplying vital minerals to fight fatigue. In order to revive oneself, it also aids in electrolyte replenishment.
To set a comparative cultural perspective, we looked at private versus public hospitals in Mumbai. Private hospitals are highly sought after because, while being quite expensive, they provide great treatment. Less time is spent waiting, and patients receive better care. Only those who can afford it receive treatment at these clinics due to the high costs of the treatments offered. For example, a private hospital by the name of Breach Candy Hospital in South Mumbai reportedly has 53 warmers, although Rajawadi has only 14 working ones. Per year, this private hospital also buys 12 more infant warmers.
Government hospitals rely on public financing and are run and controlled by the state. The quality of care often provided to patients is subpar due to the lack of resources. For example, Individualized care may be less successful in public hospitals than it is in private ones due to the low doctor-patient ratio. As a result, those who are financially strapped or have insufficient health insurance are more likely to use these services. Also, government hospitals have little to no access to funds to buy even 4 more.
According to the Indian Journal of Public Health, India would require 2,070,000 physicians by 2030. The government hospital treats 11,000 patients per doctor, which exceeds the WHO requirement of 1 doctor for every 1,000 patients.
We also looked into Western healthcare compared to Indian healthcare to see how drastic the difference is. The healthcare for children in Switzerland and India differs significantly in terms of accessibility, quality of healthcare, and availability of resources. In Switzerland, the healthcare system places a high priority in children's health and well-being. The healthcare system there is ranked third worldwide according to World Population Review. Children are entitled to the same healthcare services as adults and have access to a wide range of pediatric services, from vaccination to medicine for cancer and chronic illnesses. The Swiss healthcare system is well funded and equipped with advanced medical technology, which ensures that the children are properly diagnosed and treated. Most hospitals in the country have highly trained doctors, with 4.5 doctors per 1,000 people, compared to the global average of 1.5 doctors per 1,000 people. Moreover, healthcare providers in Switzerland are trained to cater to the unique needs of children, including physical and mental support.
In contrast, the healthcare system for children in India is full of challenges. The country ranks 101 on the scale of healthcare worldwide, with only 1 doctor per 1,445 people, according to the Hindu Business Lane, indicating a huge shortage of doctors. While the country has made significant strides in reducing infant and child mortality rates, the quality of healthcare for children remains poor in many parts of the country, particularly in rural areas. Public and government hospitals are often underfunded and understaffed, leading to untrained doctors, long wait times, and limited access to essential equipment. The private hospitals in India are more advanced and have better facilities, but the exorbitant costs cannot be afforded by most.
Overall, the healthcare system for children in Switzerland offers thorough high-quality care with a strong emphasis on prevention and early diagnosis. While the healthcare system for children in India faces many problems related to accessibility, affordability, and quality of care, our overall findings are that the government hospitals are usually overcrowded and underfunded, which leads to inability to treat all the patients which come in. Compared to private hospitals, many government hospitals rely on sponsors to provide for their equipment.
Conclusively, healthcare is something which varies from place to place, and in underfunded hospitals becomes a liability both towards the hospital and the patient. This leads to misdiagnosis and mistakes, which could be fatal. We strove to create change in the community, and by donating these warmers and protein powder, we hope we have helped a few children have a new chance at life.
On an average, the baby stays for 7 or 8 days in our NICU. Our NICU is almost always full. So considering 360 days, I consider almost 100 babies per year will be utilizing this warmer.
Therefore, we believe beginning this campaign will inspire others in our communities to help as well. We hope our campaign has also spread awareness among people around us.